Meet Jane, a 56-year-old mother, wife, accountant, and chess player. She went to see her family doctor for a flu, wanting days off work. To her surprise, during examination, the doctor noted a small lump in her neck. She had never noticed it. It wasn't painful, it wasn't visible, and it certainly wasn't a bother to her. But it was a bother to her doctor. He explained that she had a lump, or medically, a nodule, more specifically, a thyroid nodule. Thyroid nodules, or cancers, are often asymptomatic. They are discovered by accident by the doctor during a physical examination of the neck, or on imaging tests unrelated to the thyroid gland, just like Jane. Alarmed and worried, Jane asked, "What kind of cancer are we looking at, doctor?" Thyroid cancer, the doctor explained, is a certain possibility, but we do not know yet at this stage whether you have it or you don't. The thyroid gland is a butterfly-shaped gland located at the front of the windpipe, or the trachea. It produces hormones that participate in regulating metabolism, energy, and the cardiovascular system. There are four main types of thyroid cancer: papillary, follicular thyroid cancer, medullary thyroid cancer, and anaplastic. Papillary thyroid cancer accounts for 80% of all thyroid cancers, has the best prognosis. When it spreads, it often spreads locally through the lymph nodes. Follicular thyroid cancer accounts for 10 to 15% of all thyroid cancers. Medullary thyroid cancer accounts for 2% and is unique in that it runs in families. Anaplastic is the most aggressive with the worst prognosis. So what causes thyroid cancer? Jane asked the doctor. Thyroid cancer is more common in people older than the age of 40, have a family history of thyroid cancer, or have had exposure to high doses of radiation. However, for most people, we don't know why thyroid cancer even develops in the first place. High doses of radiation exposure, especially during childhood, is a strong risk factor for thyroid cancer. Radiation therapy to treat cancers such as Hodgkin's disease or breast cancer may also be a risk factor for thyroid cancers as well. Jane was now concerned and asked, "Should I be worried about the X-ray for the upcoming dental procedure I have next week?" No. Routine X-ray exposures such as dental X-rays, chest X-rays, and mammograms are not associated with the high risk of thyroid cancer, explained the good doctor. "So what thyroid cancer do I have?" Jane asked, "and how will it be treated?" Firstly, we do not know that you have a thyroid cancer in the first place. Further tests need to be done before proceeding. We need thyroid function tests, that is, to measure the levels of thyroid hormone, and refer you to an MDT. A what? An MDT is a multidisciplinary team. Think of it as a panel of experts that debate and deliberate your case and determine what is the best treatment plan for your unique case. This is standard of care. Each panel member is an expert in their own right, and they all take ownership of your case. The main treatment modalities for thyroid cancer is surgical. When limited to one lobe, as the thyroid gland has two lobes and a joining bridge called an isthmus, limited surgery may take place limited to one lobe. We call that a lobectomy. When both lobes are involved, the whole thyroid gland may be removed. When lymph nodes have evidence of cancer, lymph node dissection may also be mandated. Radioactive iodine may be used in the treatment of thyroid cancer for more advanced thyroid disease or tumors that have spread to nearby lymph nodes or distant sites may require radioactive iodine. During this procedure, radioactive iodine is administered. The thyroid cells and remaining thyroid cancer cells take up the iodine. The Iodine in this form is toxic to these cells and destroys them. The only danger that is possible is damage to the salivary glands when high doses are used. The salivary gland, like the thyroid gland, takes up iodine and will take up this poisonous form of iodine and get affected. But let's not get ahead of ourselves. First things first, let's get the bloods done and refer you to an MDT and determine whether there is anything to worry about in the first.